Welcome back, my people. We are still discussing about the conditions that can make one dehydrated, or conditions that can lead to dehydration. Why am I emphasizing on dehydration? Because it can cause serious complications like stroke and coma, and also brain shrinkage and kidney failure. That means water is essential in your daily life. It's very important to remain hydrated each and every time for the rest of your life. Before we continue, I can't forget to appreciate you people for the support. You have been of a very big help to me, because the far I've gone is all because of you. You are supporting me as one family, and that is what is most important. I also feel so good and appreciated when people say your content is helping us. Yesterday somebody told me he went through my video about management of vomiting, and fortunately or unfortunately, a kid started vomiting yesterday morning, and the kid had no temperatures. So before she came to the facility, she applied the home remedies I talked about, and the vomiting subsided. So when she called me, I told her there is no reason to come to the facility because the vomiting has subsided. So keep a close look at the child. You close monitor the child, and when you see any other complications, just come to me. And up to now, the child is doing fine with the home remedies. So in one way or another, it saved our pocket, because if she came to the facility or if she came to me, it's a must. She could have spent some money, but through my videos, she was able to save our child and to save our pocket. So let's continue subscribing, liking, and sharing our videos so that they may be recommended all over the world. And if you subscribe, don't forget to put the notification bell on so that whenever I produce a video, YouTube will automatically notify you. Let's get back to our topic, whereby we are discussing the fourth condition that can lead to dehydration, and this is urination. Who has never urinated since he or she was born? Who doesn't know what urination means? So during urination, definitely, and it's obvious, you are losing fluids. So the question is, you have urinated. How are you going to replace the lost amount of water you have lost through urination? And if you are not going to replace that lost amount of water, definitely you become dehydrated. Simple. So in urination, what is urination? Is the body's normal way to release toxins from your body. Your body's normal way to release toxins from your body. Toxins are dangerous substances in your body. The same way you can lose them or release them through diarrhea or vomiting, you can also release some toxins through urination. So, some conditions can cause chemical imbalances which increase urine output, and if you don't replace the fluids lost through excessive urination, you are at a risk of becoming dehydrated or developing dehydration. I hope you get that urination is the body's way to release toxins from your body. Some conditions can cause chemical imbalances which in return increase urine output, and if you don't replace the fluids lost through excess urination, you are at risk of developing dehydration or becoming dehydrated. So I hope you have understood the four conditions or situations that can predispose one to becoming dehydrated. So, what are the signs and symptoms of dehydration? Signs and symptoms. So, symptoms differ depending on whether the condition is mild or severe. So, you might be having a mild dehydration or a severe dehydration. So, symptoms differ depending on whether the condition is mild or severe. Symptoms of dehydration may begin to appear before total dehydration takes place. So this means before total dehydration, you should have seen some symptoms of dehydration. So symptoms of dehydration may begin to appear before total dehydration takes place, and these include the following. These are the most common symptoms of dehydration. Number one, fatigue, dry mouth, which is very, very common and is so obvious. If you are dehydrated or if your child is dehydrated, obviously the mouth will be dry. Number three, increased thirst. That's why you see if your child is dehydrated, the child will keep on taking more fluids. And also adults, if you are dehydrated, you will have the urge to take in more fluids. Number four, decreased urination or decreased urine output, which is very dangerous, because when the urine output is down or decreased, it means this is affecting your kidneys directly and it might lead to kidney failure. We have less tear production. Have you ever seen a child crying without producing any tears? This is a sign of dehydration, and a severe one. Number six, we have dry skin. That is very obvious. We have constipation. We have dizziness. We have headache and lengthy-headedness. All these are signs of dehydration. There is a very important point to note. In addition to the symptoms of mild dehydration, take this very clearly. In addition to the symptoms of mild dehydration, severe dehydration is likely to cause the following. In addition to the symptoms of mild dehydration, severe dehydration is likely to cause the following signs. And these signs might be more severe than the one we have talked about. Number one, we have excessive dust. Number two, lack of sweat production. You may have lost a lot of water that to an extent that there is no even a little water to make you sweat. Number three, we have low blood pressure, or what we call hypotension. Number four, we have rapid heart rate, or what we call palpitations. We have rapid breathing. We have sunken eyes. We have shriveled skin or wrinkled skin or old man's skin. So you may find a baby having an old man's look, whereby the skin is shrinking or shriveled. Number 8, we have dark urine. Another very important point to note. Severe dehydration is a medical emergency. As I have said, it can cause stroke, it can cause coma, it can cause kidney failure, it can cause brain shrinking. So severe dehydration is a medical emergency. Get medical help immediately if you are showing any of the above signs. Whether the signs are severe, whether the signs are mild, make sure you see your healthcare provider. So let's see or look at medical emergency during dehydration or when you are dehydrated. Children and older adults should receive immediate treatment even if they are experiencing symptoms of mild dehydration. Children and older adults should receive immediate treatment even if they are experiencing symptoms of mild dehydration. Any person, and not this, any person should seek emergency care if he or she develops the following symptoms. Any person should seek immediate health care if he or she develops the following. Number one, severe diarrhea, because it will lead to dehydration. Number two, bloody stool or stool having blood. Number three, inability to keep down or retain fluids. That may be through vomiting. Number four, disorientation. Disorientation. This marks the end of our second video of the day, and in our next video tomorrow we'll be discussing about how to diagnose, how can you tell that a person is being dehydrated or he or she is having dehydration. Guys, thank you for your time. Thank you for being with me, and let's continue supporting this channel, and I know we are going to succeed and it's going to grow bigger and bigger. Have a wonderful weekend, and let's meet in our next video. Let's continue subscribing, liking and sharing our videos so that they may reach as many people as possible. And I do appreciate a lot those who are getting help and appreciating our content. Have a good evening.